All right, guys, welcome back to Underground Science. In this video, we'll be talking about hyper-IgM syndrome. Okay, so let's go and get started. So the pathophysiology shouldn't be too confusing, right? It's actually kind of direct. And so let's see how this works. Okay, so normally, remember, for our B cells to get activated by our T cells, not only do we need this T cell receptor and MHC2 and the antigen, right? This interaction and the CD4, of course. Remember, we need a second signal. Remember, the B cells have CD40 and the T cells have CD40 ligand, and that needs to bind two together, okay? That's the second signal. Then the T cells can get activated and release cytokines like interleukin 4 and 5, which can help your B cells to class switch, right? Initially, your naive B cells, right? What do they produce? They produce IgM. But after class switching, right, due to these interleukins 4 and 5, for example, and you need these interleukins to class switch, but you only can get these interleukins if your T cells get activated, and your T cells can get activated only if you have CD40 and CD40 ligand interaction with your B cells. So once this happens, right, interleukin 4 and 5 can help your B cells class switch into producing IgG, IgE, and IgA, right? Because initially, remember, your naive B cells produce IgM. But for your B cells to class switch into B cells that produce IgG, A, and E, you'd need those interleukins from the T helper cells, right? So normally you would have interleukin 4 and 5, then your B cells would class switch into being able to produce IgG, IgE, and IgA, right? So you would have IgG secreting cells, IgE secreting B cells, and IgA secreting B cells because of the class switching process, right? That occurs due to the help of these interleukins 4 and 5, for example. And then you would have IgG, IgE, and IgA antibodies. But what happens in hyper-IgM syndrome is you have a mutation in the CD40 ligand gene. So what this means is, right, on your T cells, you don't have CD40 ligand. So this second reaction, the second interaction, I should say, can't occur. If this second interaction between CD40 ligand and CD40 can't occur, then your T cells can't get activated. And if your T cells don't secrete interleukins 4 and 5, for example, then your B cells cannot class switch into producing IgG, E, and A. And your B cells remain as naive B cells who only can produce IgM. So that's why it's called hyper IgM syndrome, because your B cells can never class switch. So they remain as B cells that can only produce IgM, which you would see in naive B cells. So you only have a bunch of IgM secretion, and you don't have any secretion of IgG, IgE, and IgA, right? Why? Because to secrete these antibodies, you need to class switch. You need your B cells to undergo class switching. And the only way your B cells can undergo class switching is if it has the CD40 ligand and CD40 interaction, right? And it doesn't, and you don't have that in hyper IgM syndrome because you don't have the CD40 ligand on your T cells, right? So that's why you produce a lot of IgM because that's all you can produce, and you're not able to produce any IgG, IgE, and IgA because you're not able to class switch. Okay, so that's what we have here. So if you don't have any co-stimulatory, no co-stimulation, right, via the CD40 and CD40 ligand signal, then you can't produce any IgG, IgE, and IgA. So you have low levels of all of these antibodies, and the only antibody you can produce, because remember, you don't need class switching to produce IgM. Your naive B cells can produce IgM initially, but that's all you can produce if you have uh, this disease that we're talking about, hyper IgM syndrome. All you can produce is IgM, right? So then you would have a high level of IgM, but you would have very low levels of IgG and IgE and IgA. So what would this lead to then, right? So again, we can go through each antibody and see what it would lead to. If you have low IgG, right, as we've talked about before, right, low IgG, then remember what IgG is good for. It's good for opsonization of encapsulated bacteria, right? So if you don't have IgG, proper amounts of it, then you have an increased risk of infection from encapsulated bacteria. Like what? Remember we said that those are bacteria like strep pneumo, Haemophilus influenza, right? And things like Pseudomonas too, bacteria like Pseudomonas, and so on, right? So encapsulated bacteria you're at a higher risk for if you have hyper-IgM syndrome, because then you don't have IgG, and IgG is good for clearing away encapsulated bacteria. Next, if you don't have we can go on to IgA, right? If you don't have proper amounts of IgA, we know that IgA is good for mucosal defense. Now, if you don't have IgA, where would we see increased risk of infections, right? Your lungs, your respiratory tract, right? So that would be one area. Of course, also your GI tract would be another area where you would see increased infections. So if you don't have IgA in your gut, you can see increased risk of infection from things like Giardia, right, which is a parasite, and certain enteroviruses, right? And in your lungs, of course, if you have pathogens that infect your lungs, like again, like strep pneumo, Haemophilus influenza, Moraxella, Catarrhalis, right? Pathogens like that can lead to pneumonia or respiratory infections. And then, of course, another thing that to know here is remember what we said, right? T cells, if they don't have the CD40 ligand, right? Then that means the T cells can't get activated, right? When they're binding to the B cells. Remember, you have your B cell here, and then you have your T cell here, right? And remember, we said you have the T cell receptor. Saw that better. You have the T cell receptor, and you have the MHC2 on here on the B cell that's presenting the antigen. Then you also have CD4, right, on the T cell that's binding to MHC2. And then we said you have your CD40 protein here, and then you have your CD40 ligand over here, right? Let's say this is the ligand, but you don't have the CD40 ligand, of course, in hyper-IgM syndrome. But normally, if you would, this interaction would lead to the activation, right, of this T cell. But because you don't have the CD40 ligand, you can't have this co-stimulation, so no activation of your T cells. So due to the T cell defect, right, T cell defect due to this can put you at an increased risk of infection from Pneumocystis jirovecii, right? So that's an important pathogen to know. Pneumocystis jirovecii. Okay, so you have an increased risk of infection from this pathogen too, due to the T cell defect. Another pathogen that you have an increased risk of infection from is Cryptosporidium, right? So remember, Cryptosporidium, right? What can this cause? We know that this can lead to sclerosing cholangitis, right? Remember, sclerosing cholangitis is when you have fibrosis, right, of your intra and extrahepatic ducts in your liver, right? So sclerosing cholangitis, and this isn't good because if you have fibrosis of your hepatic ducts in your liver, right, that's going to obstruct bile flow, which can lead to many symptoms that we'll talk about later when we talk about cirrhosis, right? And then this could lead to liver disease, right? So that's something to watch out for also due to in patients with hyper IgM syndrome. So due to the CD40 ligand deficiency that leads to a T cell defect, which can put you at an increased risk of infections from Pneumocystis jirovecii, for example, and also due to the CD40 ligand deficiency, you can also have an increased risk of cryptosporidium infections, which we know can lead to sclerosing cholangitis and liver disease. Okay, so that's basically it for this video. That was hyper IgM syndrome. I hope this video made a little bit of sense. I hope it wasn't too confusing, right? And I hope to see you guys in my future videos. Okay, so actually, before ending it, right? Just we already talked about all this in the previous slide, but if you want a quick review, remember low IgG, increased risk of encapsulated bacteria infections, low IgA, increased risk of mucosal infections like Giardia, enteroviruses, and of course, you have mucosa in your lungs, right? So that can lead to pneumonia, sinusitis, right? And bronchitis, right? Because of course, we know our sinuses are made up of mucosa too. So if you don't have IgA there, you can get infections which can lead to sinusitis, even middle ear infections like otitis media, right? Because your mucosa there also, and that can be affected if you have low IgA. And yeah, that's basically it, but we already talked about this in the previous slide, so that was just a quick little review. Thank you guys for watching. See you